Hi, my name is Brody Dennis. I'm here with my classmate Wyatt Compton, and we are both first-year students at OSU CHS. And today we're going to be talking to you about our systematic review on Family Medicine Journal's adherence to reporting guidelines and trial registration. So to give you a little bit of background, reporting guidelines have been developed as a method of mitigating inadequate reporting quality. One reporting guideline that we looked at in particular for this study was Consort. Um, and so consort is kind of used for randomized controls. And so the idea behind reporting guidelines is to make sure that the data that is taken from the studies or the data that is presented from these studies is unbiased and accurate. However, it is not the case. Reporting guidelines are not always used in studies. And so we decided to look into family medicine journals in particular and sort of analyze their adherence to different reporting guidelines as well as clinical trial registrations. And so I think Wyatt will go ahead and go over the methods.
Yes, so our methods for this systematic review of family medicine reporting guidelines. So in order to gather data, we assess 45 active peer-reviewed family medicine journals using the 2021 Scopus Site Score tool. We also sent out emails once a week for 3 weeks to the editors-in-chief or any members of the editing staff of these journals. And our goal with that was to see if these journals had any article types that they did not accept. So data containing requirements or recommendations of reporting guidelines were extracted in a mass duplicate fashion from each journal's instructions for authors page. Statements regarding clinical trials registration was also obtained in a similar manner. So going over our results now, in figure 1, you can see the Prisma flow diagram of journal selection. We began this study with 45 journals from the Scopus Site Score tool, and then we narrowed that, and then we also used all 45 journals for inclusion screening, with only one journal being excluded just because it was discontinued. And so we ended up with 44 journals for data extraction.
And so next to the Prisma diagram, you can see we've got a couple of pie charts. And so the top pie chart displays the clinical trial registration. The orange is the amount of journals that required clinical trial registration, and it's only about 57% of the journals. About 35% did not mention study trial or study registration, and only 9% recommended it. So just over half required it, which is not as much as I would have expected. The pie chart right below it is for the Equator Network. Here we've got about 70% that mention the ICMJE, and about 30% did not mention the ICMJE.
If you look over at table 1, you can see a broad overview of the data collection that we performed in the study. On the left side, you can see the metrics that we used, so whether or not the journals did not mention, recommended, required, or did not require the specific reporting guideline. And you can see it broken down between the number of times it was not mentioned, recommended, or so on, and the respective reporting guideline. So just for example, we have quorum as the most not mentioned reporting guideline. And then for recommended, the reporting guideline that was mentioned the most or that was recommended the most was Consort. And then so on, the reporting guideline that was required by journals was Prisma. And then very few of the journals explicitly said that they do not require quorum or Prisma, and so on.
Right. So in conclusion, kind of going back to that table, about half of the journals that we analyzed recommended studies or trial or recommendations, such as Consort, Prisma, and Strobe. But really, if you look along that top bar there, most of the reporting guidelines were not even mentioned in any of the instructions for authors. And as I mentioned earlier, only just about over half of the journals actually required trial registration. And so in order to better research in the future, we believe that these journals should explicitly state that they require the clinical trial registration, as well as many of these reporting guidelines, in order to improve the quality of the research and make it unbiased.